Welcome back to the question and answer or Q&A follow-up to our Tuesday webinar on Medicare for Christian Scientists. Thank you for joining us today. And special thanks on this Veterans Day to those who have served or are serving in our armed forces. I'm John Mitchell, Executive Director and CEO for Arden Wood here in San Francisco. As we well know, Medicare is complicated. Hopefully this week's presentation has been clarifying by our friends Jim Maher, Katie Burris, and Lesleah Frisco. It's been clarifying and helpful. They are with me again today to answer your questions, and they are available at any time by phone or email to address your specific issues. Their contact information will appear on your screen at the end of today's webinar. One other resource you are welcome to contact is the Christian Science Provider Network. I'll say that again, the Christian Science Provider Network. Their website is csprovidernetwork.org, csprovidernetwork.org. Let me say again how wise it is to give thought to a care plan in the event that a need arises for Christian Science nursing care. If you have such a need, your focus will be on God and healing, and not on a stack of paperwork and how to pay for care. And care is expensive. We'll talk about that in a bit. Thinking through your options now is key. Let me also say again that Arden Wood is not advocating for Medicare. It is simply one choice that's open to you if you're 65 or over because you paid into Medicare with each paycheck you've received throughout your working life. Being on Medicare being on Medicare or not does not change the care you receive from our staff. It simply comes into play when you're paying your bill. As you know, we are a Medicare Part A provider here at Arden Wood, known as a religious non-medical healthcare institution. That's the legal name. So when you hear the acronym RNHCI, that's what it stands for. Last but not least, the content shared today is only informational and is not intended to be legal advice. A replay of this webinar will be available on our website tomorrow. And now, Jim, Katie, and Leslie are ready to answer your questions. We'll be taking some from on Tuesday and then from today. Please post your questions on the Q&A icon at the bottom of your Zoom screen. We will answer as many as we can in the next hour. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. Jim is also a certified long-term care insurance strategist. Katie Burris is a Medicare specialist and a certified long-term care consultant and a partner at McGrew and Maher Insurance Services. Lesleah Frisco is our own Arden Wood's Director of Christian Science Nurses Training. One of Leslie's previous responsibilities was to work with Medicare to ensure proper coverage for our patients who choose to use their Medicare benefit. So we've got the questions. Let's get underway. First one, this is from Tuesday. How do I purchase a supplemental plan like Part G?
So Plan G can be purchased by going through the insurance companies, and we assist with that process. So by reaching out to our office, we can get you the quotes for what it would cost, and we can walk through the process. The application is actually like a really simple application that can be done via a 10 to 15 minute phone call with myself. I would ask the questions, pre-fill out the application, and then you get an email just to DocuSign it.
Makes it easy. And every state's different, right? And we deal with probably 20 to 25 states nationwide. So every state's a little bit different, but bottom line, we can help you.
Excellent. Next up, if you have Medicare Parts A and B for a few years, can you add D without penalty?
Well, the answer is yes, you can during this open enrollment period right now. That's October 15th through December 7th, and that would be effective January 1. But you have to ask yourself, right, especially if you're a Christian Scientist, you really need Part D. We're not advocating. I used to advocate all the time, say you really need to get it, but now that I understand it's really a personal decision. But if you haven't had it for a while too, Katie, they could be subject to fine.
So you can get it during this time, but you would be subject to the fine.
Right. Yeah. And the other thing holds true too, John, is the opposite is if I've had it and I'm paying a fine, now would be the time to drop it. Because we have talked to some folks who say, gee, I inadvertently signed up for it and I don't want it any longer. So if they terminate that plan now during the open enrollment period, then that fine goes away also.
Great. Explain again the value, and to our friends, there were some repetitive questions here, but we just want to answer them so they're asked and answered. Again, explain the value of G for Christian Scientists, please.
So
Part G, excuse me.
So with Plan G, the way that would work is that if you are in a rinky like Arden Wood, and like Leslie will tell you, it's a Medicare approved stay, it would cover the cost up to 365 days, as long as it stays a Medicare approved stay. In addition, on the Part B, the medical side, that would come into play too in certain instances. For example, if you're out in public somewhere and you fall or you pass out and they take you via ambulance to an emergency room, if you have a broken bone and you need x-rays and to have that set, that's when that Plan G would help. So you would be subject to that $203 deductible for this year. And then you would not have to be responsible for the 20% after that.
Right. Hey, John, you shared a great example. I know it was yourself in a dealership, but I think that's a really good story to tell again, because we can talk about why it's so important to have pre-planning, right? If something does happen to you, and kind of bring in the healthcare directive into that too, possibly.
Yes, just very briefly, I was bringing my car for service down here at Serramonte, about 5 miles south of Arden Wood here in just below San Francisco. And I wasn't feeling well. We were getting ready actually for our Christmas program, and I passed out and woke up in San Francisco General to my wife and daughter. And you know, they had already run a bunch of tests to I was unconscious, but they ran these tests and so on. And then basically my wife said, we'd like to take John to Arden Wood. And they said, he's not going anywhere. And so it's like, oh boy. And that's when I was starting to wake up. And then I could see that there was a gentleman, an orderly or whatever, had all kinds of tests ready to go. And then it wasn't until my wife talked to Leslie, and Leslie explained that we were a Part A Medicare facility because I'm not a Medicare age. And I wish I would have had two things: the directive, advanced healthcare directive, that would have helped me get out no matter what. But since I didn't have that with me and hadn't had it in place at that time, it was basically Leslie's conversation with the emergency room director that got me out of there. But there's all kinds of things. And that short stay, even though we were fully insured, we weren't in network. So out of pocket, it was like $10,000 for a very short stay. Just the ambulance ride alone, 9 miles was 25 for maybe I can't remember, like $4,000 or something crazy. So the numbers, and Leslie, you were going to say briefly about what it costs when a bone is set.
Yeah, I want to say 911 is not free.
Oh, excuse me. Thank you for that.
We'll throw that in, and they will take you to the nearest hospital. They will not take you to a place of your choosing. They will not take you to a Christian Science nursing facility or to your home. They will take you to the nearest hospital. That's their responsibility. Then you have to be able to get out of there. So having an advanced healthcare directive in place, which everyone should have, no matter how old you are, is just very important. So it's a legal document that will state what your wishes are. You can state, I am a Christian Scientist. I do not want medical care. I do not want testing. I do not want to be on life support. All these things that are near and dear to your heart are written and notarized and in place. So if you're ever not able to speak for yourself, someone who you've appointed as your agent will be contacted, and they produce that document at the hospital or wherever and say, this is this person's choice, and it will be honored. So
yes,
they will do whatever they need to stabilize someone, but they can let them out if they can if this is in place. It's very helpful.
And everyone's trying to do the right thing. Sorry, Jim. Yeah.
Exactly. And I realized the other question, did you want to say more about advanced directive, or shall I go ahead and speak to the cost of?
No, yeah, speak to a place, yeah.
The cost of x-rays, I think because Christian Scientists don't routinely have medical care, they have no idea how much. I have seen patients' bills. Someone who went out for an x-ray did not have a bone set. The x-ray alone was $12,000.
Wow.
Someone else that had a couple of broken bones and their bill was $127,000. So this is why having Medicare, original Medicare, having a Medicare supplemental, it will cover these things.
Yeah.
So, yeah.
So
That's such a comfort to family members too. Excuse me, Jim. Excuse me. Yeah.
Yeah. So I was going to ask Katie. So Katie, if that's a situation, would they, if they're going to emergency or outpatient, is that going to be under Part A or B? And whichever parts it's under, what would the supplement, if they did Plan G, what would their out-of-pocket cost be versus the $100 and some thousand?
So with an emergency room, with if you need a bone set, if you need x-rays done, that's all going to fall under Part B. So just having original Medicare A and B, you're subject to that Part B deductible. So for this year, it's $203. And then you would be responsible for 20% of the bill after that with no maximum. If you have Plan G, once you hit the 203 deductible, everything is covered in full after that.
Right.
If you need like a bone set or anything like that.
So again, it doesn't matter on the total cost if it was the 100,000+ or 12,000 or whatever. Once with that Plan G, once you fulfill that Part B deductible, if this year it's $203, you're covered in full. That's what we're trying, I think, the point, how expensive care can be. Katie and myself, since we deal with a lot of non-Christian scientists, we see incredible costs incurred at 3 or 4 days, 5 days, and 2 days in the hospital, $150,000, $140,000. So we try to prepare people for it. So I think this is really good that people understand how expensive it is in those examples and what they can do to mitigate those costs.
Absolutely. Exactly. Thank you. Next up, I'm 64 and my husband is 52. So he'll likely be working well past my currently planned retirement at 70. I'm a Christian Science nurse. Do I need to enroll in Part A and will probably choose Part B as well at 65 anyway? He works in a school system and there are more than 20 employees. The coverage that works for him is an HMO, which I'm covered under, but I know won't help me with it in a rinky. Anyway, suggestions to consider?
So in that case, it may be good if you're in a non-HSA plan to pick up Medicare Part A. So that may be a good thing to do. I would not recommend picking up Medicare Part B as long as you're on the group plan, because Medicare Part B isn't going to work in a rinky anyways. And if you needed any sort of, broken bone, anything like that, would be covered under your medical plan, not under Medicare. So Part A would be good. Yeah. Part B, you don't need.
And to clarify, we're not fans of HMOs,
right? Yeah.
Medicare Advantage.
Thank you.
However, it's not that they never work in a Christian Science facility, it's just very difficult. So we will go to bat for you. We will spend hours and hours negotiating and trying to get them to understand their responsibility to pay. There's not a guarantee it will pay, but we will do our best. So don't just assume you can't use it. It's just so much easier if you have original Medicare. But we understand, especially with group plans and family, employment related ones, you may not have a choice.
But Leslie, they can really delay payments to Arden Wood, correct? I mean, you can talk
a couple of years sometimes.
A year. And John, how do you run
appeal
a business
process
like that? Quite honestly, right? You've got to have income coming in or money's coming in.
Imagine providing care in January of 2020 and in November of 2021, you haven't been paid yet.
Yeah.
Think of that. So
my husband wouldn't like that if I told him I'm not being paid for a year.
Yeah, right. That doesn't work well. No.
Next up, when I signed up for Medicare, I didn't elect to get Part B. My husband did get B, and he also has GEHA.
Yeah.
I remember, you know what that is. My husband has passed, but as his wife, I was able to continue getting DEHA. Will it take me getting Part B to receive the benefits?
So she's talking about the Government Employees Health Association for federal employees. That's what that acronym stands for. But my understanding is normally on their retiree plans, you have to have both A and B, right? Because Medicare becomes primary as the primary payer, and that plan would be, the association plan would be secondary payer. But she should definitely have that talk with somebody, their human resource department or something to make sure and find out. We're under the impression most every retiree plan, employee plan has to have Medicare if it's a retiree plan, both Part A and B.
Mhm.
Yeah, so it's important that you do that. You don't want to find out too late that, oh, gee, I should have done that, and they're not paying a claim.
Great. Do you recommend United Healthcare, AARP?
Me personally, I do a lot, yes. And the reason, they have one of the largest blocks of business in the Medicare supplement industry, over almost, I think it's 4.5 million plus. And that's so important because when we talk Medicare supplements, the most important thing is rate stability, right? Don't tell me how cheap something is today. I can buy a cheap plan. Tell me about 2 years, 5 years, 10 years down the road, what that company is going to do. And for me, we just don't have issues with them. AARP actually endorses United Healthcare, and that means a lot in the Medicare supplement world. What you don't want to do is we see companies come into the market that are, I don't call them fly-by-nights, but they're here for a short period of time. They bring money in, then they're gone, and people have these incredible rate increases because they have a very small block of business. Insurance is all about the large numbers, John, when they can spread risk, right? And the more you have, the larger the population, the less the rate increase. That's super important. And Leslie, I think you were telling us how much you like the United Healthcare, the way they pay.
Yeah, they do. They do pay us. They readily pay us without question. So we're really grateful. I mean, as a Medicare supplemental, it should all go through very smoothly, but United Healthcare always does.
That's good to hear. Yeah.
One of the things that we look for most importantly in an insurance company, and we deal with lots of them, and there's some we don't deal with any longer. We look for ones where they have good rates and their claims payability is good.
Right.
Because the last thing I want is I have a client that has paid for years for a plan and now they need to use it and they go to file a claim and there's a hassle.
Right.
Because that's not what you want. You pay money so that they can help you, not fight you.
And Leslie, I've also heard from other facilities, non-Christian Science facilities, how much they like the AARP United Healthcare plan also. They get paid quickly and well also.
And also with insurance, this is kind of a sidebar, but you always want like a AAA rated or a well-rated insurance company, not somebody that's, yeah.
That's exactly right, John. And I always look at the rate stability, right? Because when people are buying something, like my mom said, just don't buy cheap. It always comes with a price, a cost down the road. And she was right. She's telling me, don't buy cheap shoes or a cheap mattress because you're going to pay so much more for it to buy different pairs or another mattress. But insurance, it's so important. We see people all the time. They go, gee, Jim, well, I'm going to buy, or Katie, I'm going to buy this one. It's cheaper. And I go, you want a good quality company at a very affordable, but a good rate. You don't want to ever buy the cheapest, lowest plan. That would be my recommendation.
I had a conversation with a client this afternoon that had switched themselves to a plan with a zero premium, one of those zero cost plans. And they said, we didn't realize, they didn't tell me that the out-of-pocket was $6,700 and that some of the stuff is like a 20% copay. And they go, I made a mistake.
Yeah. And we were able to fix it because they're still in the open enrollment period now. So that's a big deal.
Well done, Katie. That's great news.
Pat her on the back right there.
Next up, how do they calculate the penalty for Part B? I only have A and want to get a supplemental G plan, but not sure what my Part B penalty would cost. I'm 74 and have had Part A since I was 65. Thank you.
The penalty says it is a 10% penalty for every 12 months you did not have Part B and should have. So depending on when that person's birthday falls, so let's say it's between January and June And so by the time they are able to enroll in Part B next year, it will have been 10 years.
Right.
So you're looking at 100% penalty. To get an accurate estimate of exactly what that penalty would look like, and for confirmation, you would definitely want to talk to Social Security between January 1st and March 31st, because that's a general enrollment
That's right.
time.
Yeah.
Great. Next up, my husband is not a Christian Scientist and has Medicare and a supplement plan, and is in Nancy. I want to get a supplemental plan, but not sure I quite understand the general enrollment period. Can you tell me how I can do that and when I can get the insurance?
So I'm sorry, she was saying she does have A and B already.
She did not indicate that.
So let's assume she probably has, if she's 60, she's probably receiving Social Security. So she's probably got at least Part A, I would assume. So let's say.
I would assume that.
Yeah.
So if you need to add Part B, then that's done through Social Security, and that would be done from January 1st through March 31st in any year. So if you want to do it next year, that thing says Happy New Year's, like calling Social Security on the 1st
Yeah.
and talking with them. So anywhere between January 1st and March 31st, they can enroll you. They can tell you of any penalties that would apply. And if you decide to apply, your coverage would be effective July 1st. And then that's when we could get insurance started, would be July 1st to match
Right.
that as well.
And then that insurance is guaranteed issue, right? There's no waiting periods or anything like that. It's absolutely guaranteed on
Mhm.
July 1st. And I don't understand. I mean, I've asked Social Security, why the delay? Why can't they just do it during the open enrollment period? It'd be simple.
Like if I apply it
easy,
in January,
right?
it's effective February 1st.
Why-
I don't know.
Why is it? I don't know. You know, I guess because maybe they're looking at the penalty phase, and I guess you wait
Mhm.
longer. And if you get one 12-month period, then you're subject to that penalty. I mean, it doesn't make any sense to me, quite honestly.
Next up, does Arden Wood accept all Medicare insurance plans? I have the low-cost one that you say is difficult to use. Well, but she's on it. He or she is on it. I live in Oregon, but would like to receive care at your facility. Can you tell me why again, please?
Well, if it's a Medicare supplemental and you are indeed Medicare level of care, it should pay. Am I right, Jim?
Yeah, the Medicare supplement, but I think she was saying one of those, is it a low cost or no cost plans? So she would be talking
Is
about
an HMO?
Medicare
Advantage.
Advantage. Or anything like that.
That's the way I understand it.
That's the way I understand it, yeah.
Okay.
So,
So we can help you. It's just a matter of getting authorization and then once we can communicate with them, getting them to be able to pay. So that's the challenge we have. They are supposed to cover everything that original Medicare does. So, but they don't understand that. They're looking for a diagnostic code, which we cannot give them because we do not diagnose. So there are little communication issues like that. I know, John, what might we add to that?
Also, I think the thing that you talked about, Jim, so you, Katie, have talked about so clearly is that if you have just original Medicare, you can go anywhere. But if you have these different plans, they can be regional, that that aren't, you're out of network if you go somewhere else, and that sort of thing.
right.
An original Part A, it doesn't cost you because you have paid into it. That is the part that applies at Arden Wood.
Right.
So whether you went on to get Part B and a Medicare supplemental, that aside, original Medicare will cover most of the cost of your care at Arden Wood. Depending on how long you're here, there is a deductible as well.
So a good suggestion might be to, give us a call, because right now is the time where you can change. So if the goal is to go to Arden Wood and use Medicare, you'd be much better off switching to, a Medicare supplement by coming off that Medicare Advantage plan. You would have A and B, and then you'd qualify medically to have to answer the health questions, which most Christian Scientists do easily to get that. But if that's your ultimate goal, you'd be much better served by having Medicare and a supplement to be able to come to Arden Wood than a Medicare Advantage and HMO type plan.
Great. If I only have Part A, is it better to have, if I only have Part A, is it better to just get a long-term care plan? can I use that as at a Christian Science facility? I'm worried about the penalty I'm going to have to pay. I'm not sure I understand the difference. Thanks so much.
It's
That would be
different.
Leslie.
It's different level of care. Medicare coverage is for more skilled care, and it's a short-term care. So long-term care is for lighter care, which is also less expensive. So that might be useful in a sheltered care program. You might be able to use it in a skilled care situation, but it will not pay as much. So it's not as robust as the Medicare supplemental. But the other thing is that unless you have a Christian Science rider, there is a possibility that it will not pay Arden Wood.
Correct.
Right. Leslie, can you tell us, we get a lot of, questions on that too, and I'm not real familiar with some of the Christian Scientists. I think they have the long-term care riders, right, which you're talking about.
Mm-hmm.
We've had a couple calls about that, but I'm not sure I understand that totally either. Can you take us through it? So if somebody does have that rider and they do need care, they can use it at Arden Wood.
Yes, I mean, if it's written into the policy that they will cover in a Christian Science nursing facility, then it should work here. We are accredited, so that usually is what they're looking for. What many long-term care policies are looking for is that it's licensed by the state, and we are not. We do not dispense medication. We're not required to be licensed by our state. So we're kind of under the radar for that. So it's just being able to speak the language with the insurance company, whether they will pay or not.
And we do have some long-term care options. I know we've worked with Christian Scientists in the past and are currently working with some where there are plans where when you qualify for the long-term care benefit, it pays a cash benefit. So you can use it at Arden Wood. You can use it at another Christian Science facility.
I would say the long-term care is really designed for more nursing home type care. And I think people look at a Christian Science facility and say, well, you're a nursing facility, but we really are more of a skilled care facility, kind of an alternative to a hospital. So often people don't come to us until there is a greater care need that is the Medicare level, where a supplemental plan would be more beneficial than a long-term care.
Great. Leslie, we do have to get you a Mecco shade. If people are wondering, what is that on Leslie? It's a sunny day here in San Francisco. That's a good thing. But we need to get some Mecco shades. There you go. That's great. Thank you. Next up, does Medicare cover me at all Christian Science facilities? You mentioned there are only 10. Now we learned there's only 9 because one facility in another part of the country is not going to be having Medicare anymore. But I know that several that provide care. How do I know if they take Medicare and Supplement Plan G? Thank you. Boy, everybody's polite. They're all saying thank you.
That's a good thing.
Well, originally there were a number of Christian Science facilities that participated in Medicare. Several over the last many years have gradually withdrawn from it. That's been a choice that they have made. So you can call the facility in your area and ask if they participate in Medicare. That is also the only way that a Medicare supplemental plan will work, is if they are in a facility that is accredited by Medicare. So there are those 9 facilities. So,
and we've chosen this, maybe just say why we've chosen to stay with Medicare. I mean, there is people say, well, and that's why I tried to mention in the opening, we'd rather work with Medicare than an insurance company. So maybe just talk about that just for a moment.
I think the Christian Science nursing accommodation within Medicare is a wonderful accommodation where Christian Scientists who have paid their money into this can actually use a benefit. So it's huge in that regard. It also, as a Christian Scientist, it gives us a place at the table. It recognizes this is skilled care. It is proper care. So I personally think that is a good reason for us to be in, but it is not intrusive. The Christian Science nurses on duty that are giving care, they don't know who's on Medicare and who's not. We are not diagnosing. We are, our Christian Science nursing managers will assess the needs, and we may write a rationale that simply states what the care needs are that would justify a skilled level of care, but it's not a diagnosis. This information doesn't really go anywhere. It's only occasionally there may be a Medicare audit. They may ask for records for a handful of patients, but it's not like we are submitting this data monthly and someone's reading it, they're not. When we work with the Medicare Advantage plan, we are sharing the information we have, and the decision for whether someone is covered is made by medical personnel. That is much more intrusive. They will also they may determine very quickly that someone needs to come off of coverage, even though there is a skilled care need, but we can't articulate it in the terms that they're used to understanding. So that's a tricky thing.
That's a really important distinction there, Leslie. And even when we talk to non-Christian scientists, so when you're on a Medicare Advantage plan, the insurance company really is the one that's making the decision,
right.
especially even if you need something like pre-authorized before you need a surgery. With original Medicare and a supplement, the doctor, or in this case,
Christian
the
Science
provider,
nurses,
Right.
they get to make the decision.
Right. Yeah.
Mhm.
It's really good to know this stuff. Great, thank you. Does Medicare, excuse me, I guess try that one. I very much appreciate your presentations on Medicare and long-term care. I've watched them several times. How much do you charge for your advice? I don't mind paying, but I don't see any fee schedule. Is it different for Medicare plans?
So we don't charge fees to work with people. That's just not how we work. So when you work with us, we provide our advice, our information for free. And then when you write a policy, when you go with a supplement or a long-term care plan, the insurance company pays us for helping you.
Right. It works well that way. We've been doing that a long time, combined 50 years, right? Combined with us.
Yeah,
It works really well. Yeah, I'm the old guy. She's not, but it seems to work good. You know, if we charge fees, we normally do that to insurance carriers if we provide advice, things like that, but it just doesn't work well, right? Having to charge somebody. But it's so important that if we try and help you, when you do place your business with us through the insurance company, there's no cost to you. And they compensate us. And like Katie said before, my wife will not let me work for free. Okay, I did 33 years ago when I was starting off. I did a lot of that, and that doesn't work well. But it works. That model works really good. You help people, and if they work with you, we're compensated, and we just repeat it over and over and over. So
it just hurts us if we spend a lot of time with you and help you, and then you go with maybe another agent or someone else
Right.
and work with them, then we don't get paid for our time. So
and that
makes it
happens.
hard.
Yeah.
And I just wanted to say how much in the last few years we've been working with Jim and Katie. I mean, the hundreds, if not thousands of Christian Scientists you have spoken with, but you've also gone to bat for Christian Scientists with insurance companies to try to explain what we need, what we're looking for, and helping, because you know their language, you know the medical language, and now you've learned our language. So you've been a huge, huge help to Christian Scientists, not just in the Bay Area, but all over the country.
Well, thank you.
So you have earned your compensation. So really hoping we'll come back to you with some business for you as well.
And how many times we've had to explain to insurance company they're Christian Scientists, they're not Scientologists. Like we understand what you guys.
We know the spiel. Yeah,
so hard.
Yeah, and I always look and I go, gee, if I was going to start an insurance company, why wouldn't I just want to work with Christian Scientists? I mean, you're incredibly right, John. They're incredibly low risk population, very low risk, and yet you talk to these people who have all these initials after their names that think they know everything, and they don't get it. They'd rather deal with somebody that's got 10 years of they're on 6 prescriptions. They go to the doctor 15 times a year, and it frustrates me. But I'm always looking, so we're always constantly trying to find something that would help a lot. If we could do a whole block of Christian Scientists, right, and get something easy for them. So thank you for saying that, Leslie, but we really do try.
We're grateful for you and Katie, Jim.
Yes.
I live in North Carolina and want to get Plan G. I have, N is popular. I have N as in Nancy, I should say, and then N as in Nebraska now. Can I sign up at any time?
So normally it's within 30 days of your birthday. Some insurance companies are allowing right now, they have, promotions where they'll move you to Plan G. You will have to answer health questions because it's considered a buy-up. It's considered a better option than N. So you would have to answer those questions. And again, you can always call us, and that's something that we can help walk you through.
You know what's interesting? We've gotten quite a few calls from North Carolina. We are licensed there, but it is interesting how many people have N instead of G. And again, just to make it simple, I think it works so much better. You've got that one small deductible. If something does happen to you in an accident, Leslie, then you pay that Part B deductible, and then you're covered in full. You don't have to worry about, am I seeing a Medicare provider that takes assignment, that doesn't take assignment? I still have to pay co-pays too, and things like that. And normally the cost isn't that much more for a G than an N. So I think it just makes it easier for everyone, quite honestly.
It goes back to when you're needing to get the care, it's one less thing for you to have to hassle and worry about.
Yeah.
Yes, perfect. You've been very helpful explaining Medicare and different plan options. Will you be doing this every year? Do you only help individuals who want to use Arden Wood? Thank you again for doing these. Good question.
Oh,
I can speak for Arden Wood. As long as I'm here, we'll be doing these things. Because I think you can see that it's providing a service. We want to show proof of our utility, and we want to get paid, and so it is so confusing. And I think Christian Scientists, we are a healthy bunch, and we do what we do, but we also want to be wise in terms of how. And also understand the incredible costs that can be incurred in a very short period of time, completely unawares. So I just leave it to you all, you both.
We love doing these. I think I really like this kind of like the roundtable discussion. I think it's good for everybody to hear from the non-Christian scientists what we deal with, and from Leslie, somebody who has to deal with billing, and John is the CEO. I think it's good to have everybody together. I like this kind of open-ended mic style. I really do.
And then to answer the other question, we do work with Christian scientists, non-Christian scientists throughout the country.
Right. Not just, and a lot of people though, they want to make sure they can come to Arden Wood, John. So that's from all over, New Jersey, North Carolina, Ohio, Pennsylvania. Yeah, you're very well liked and very well known. So you got a great reputation.
We're just grateful. Leslie, can you talk for 1 minute about other funding sources? Let's talk about, please.
I was just thinking about that. So we're very grateful for the National Fund for Christian Science Nursing. So it is a benevolent fund that is available for Christian scientists to apply for, but it's a very simple application process, usually approved within a couple of days. It is for care, any level of Christian Science nursing care, whether it is in a Christian Science nursing facility or whether it is in the home, could be the visiting service, or even a family member that is a Christian Scientist that is providing the care. So they will provide, it's a few $100s a day toward care. And we're so grateful for them. They can also offset the cost if maybe someone only has Part A Medicare and someone is in a Christian Science nursing facility. They can help with some of the additional costs there. They've been able to help with, as I said, all levels of care. So even maybe sheltered care level. So their address is nfcsn.org. It's administered through the Principal Foundation, and we are most grateful for a number of donors that have come together to create this fund.
A huge help. Exactly. Thank you, Leslie. Next up, this is a good statement and question. Thanks for confirming that without enrolling in Medicare Part B, really nothing can be added as far as a supplemental insurance. That's a non-starter. So once again, if you don't have Part B, you can't enroll in a supplemental. And here's a more specific question. Do you have any possible data on how many Christian Science Medicare recipients opt into Medicare Part B? Since it's based on a purely medical model, what would Christian Science recipients use Part B for except to qualify for Parts C and D or other supplemental insurance? Ambulance rides to a Christian Science institution?
Let me jump in and then I'll let Jim finish.
Oh,
So as far as Part B, it does not apply at a Christian Science facility, but it does apply for ambulance. It may not apply for an ambulance from your home to the facility, but it can from a hospital. If someone, maybe they had a fall and they had x-rays and they were in the hospital, it can pay for the ambulance to bring them to Arden Wood for their so-called rehab. So that's where it can come into play. If 911 is called and unbeknownst to you, it's called, or a family member calls, it can help pay for that as well. So, and then if one does choose to have x-rays, or sometimes family members will want someone to have a test or check up any of those things, it will pay for any of the medical part of your experience. The Part A is room and board, and that's why that applies to us. It's the nursing care. But the B is anything that a physician is doing or over in the emergency room. Take it away, Jim.
And
Katie.
I like Katie.
And then, yes, as far as having the supplement plan, you can only get that if you do have both A
Right.
and B in place, correct?
And this is, you touched on it, Leslie, in your answer, but I think that's one thing that we've been trying to encourage people to do is work with Katie and Jim. You know, you can go to our website. You can also get there's a Medicare descriptor that's annually put up on our website. So you can learn, you know, what is it called, Leslie? Learning about Medicare. I don't remember the name of the title that we put on. Your guide to Medicare or whatever it is.
Guide to Medicare, and it's
Anyway,
updated
I should-
annually.
Updated anyway. Sorry, I should know the name of it off the top of my head. But this is an important point about telling your family how you've set this up, so that, because even though they might not be asking, they will be comforted to know you've got a plan. You know, okay, children, loved ones, we've got this set up in place should a need arise. We've got the Advanced Healthcare Directive, so that they know that you've got a plan, as I say.
And have it together, have it in a file, have it in a folder, a notebook, have family members have copies of things, just so if there is a need, this information is accessible.
So here's kind of a repeat question. What type of supplemental insurance? And this, once again, don't forget, you can look at this is just the Q&A session. So the actual presentation was on Tuesday, and that's on our website. You can already pull that up. So some of these, here's a repeat question. What type of supplemental insurance would be of best help to a student of Christian Science?
So what we're seeing commonly is Plan G, just because of the little to no hassle on that. So when you're needing care, not having to worry about what type of provider, and then because it can assist with the Part A side as well.
Great. Whatever happened to, here's a good one. Whatever happened to the insurance called Serving Christian Scientists, or SCS? We looked into SCS over 5 years ago, and they were having trouble fitting in with Obamacare. And so we got nowhere with that avenue.
That's correct. They're not writing new policies. They're not able to. It doesn't fit anymore. But if you have a policy, hang on to it, because they still will pay. They do pay very readily anyone within a Christian Science facility. It's just they can't write new policies.
Because it doesn't fit in with the legislation, right, in terms of what they offer. Exactly right. Thanks also for the Social Security phone number, and we'll consider applying for Part B at some point, as we are interested in a Medigap supplemental insurance. Okay. Will you be discussing which Christian Science institutions are accepting Medicare payments? How much is typically covered with Part A, and how much is left for the patient to pay? What is the typical daily rate at Arden Wood, for example? And is 80% covered by Medicare Part A, with the remaining 20% the patient's responsibility? Is there a supplemental insurance tailored to pay for Christian Science care? There's a lot wrapped in there.
There's a lot wrapped in there. Can we reel it back a little bit?
Unbundle it?
First part.
Okay, yeah. Will you be discussing which Christian Science institution are accepting Medicare payments? Let's do that.
Do we have the list of them, John?
Yeah, that list will appear at the end
At
of
the
this
end.
Q&A session, and it did at the end of the presentation on Tuesday.
Okay, so stay
That's-
tuned.
Stay tuned. How much is typically covered with Part A and how much is left for the patient to pay?
Okay, so, and it all depends on how long someone is here. And what, if they are skilled care, there is a deductible, and Jim can know exactly, it's 1,400 and change,
1484.
1484 for the first 60 days. Now,
Right.
if you don't need to be here for 60 days, that's fine. Maybe you'll only use 20 days of it, and that's great. But you have up to 60 days of coverage as long as you continue to qualify for that level of care. So that would be the out of pocket if you did not have any supplemental insurance. Then you go from day 61 to 90, you go into a copay, and the daily rate that Medicare pays everything over
$371.
$71. These
Right.
will go up in 2022, just slightly. Every year they do. And then when you get to day 91 to 150, there's a one-time lifetime reserve you can opt
Right.
to use. And that is at
42.
742. So Medicare will only pick up anything above that. So these are all big numbers. And I
Mhm.
think we went in the last presentation, if someone did not have supplemental and stayed that full time, we're talking over $50,000.
It was, I
Out
think
of-
it was like,
Over 57,000.
yeah,
$57,000.
Yeah.
Okay. Now, not everyone stays that long. I mean, we expect quick and whole healing, so it may be a
Yes.
very short stay. It could be you're only here for 3 or 4 days, and then the deductible of the 1,400 would, and whatever change would be all. So the cost of care will depend. If it is skilled care, every Christian Science facility's rate system is a little different. Ours is a tiered system. And I would say our base rate for skilled care is $585 a day. That's $585 a day. And I'm not remembering at the moment how many hours of care that is. It's based on, it's 3 or 4 hours of care, skilled care.
Right.
And then as you move to a different care tier, if it's more like 6 hours of a day of care or 8 hours, it goes up. So it could be as high as $900 a day. So this is what Medicare is able to cover. So that first 60 days, 1,400 and change is it, and everything else is included. What is not included is Christian Science practitioner treatment. That's never been a part of Medicare, and it won't be. That is a separate. There is funding available to help with that. It's important that you have the support of a practitioner. It's important that they are paid. The National Fund for Christian Science Nursing can help with that too.
Yes, that's part of our accreditation. Every patient on the second floor, in our case, our Christian Science nursing floor, must be working with a journalistic Christian Science practitioner
Daily.
and then daily, right? That's part of the accreditation that allows us to operate.
And
Part
then
of healing.
the only thing I wanted to expand on that, Leslie did a great job, is if, let's say that was a Medicare approved stay that lasted more than that 150 days, if you have just original Medicare, it stops paying at that point. But if you have that supplement in place, that supplement would continue to cover that in full as long as it's a Medicare approved
Right.
stay up to 365 days. So that becomes a huge benefit at that point, especially.
Yeah, if you look at the overall cost versus a supplement, I mean, the supplement's just, I mean, when you see a $57,000 bill, I mean, I'd much rather pay a reasonable monthly premium to know I'm not going to pay anything, quite honestly.
We've talked about benefit periods. So if there was an ongoing need for skilled care that went on beyond that, you go into Medicare exhausted benefits. You are still in that same benefit period. And until you do not need that skilled care, you are not eligible for a new benefit period. You
Right.
just continue on and it's full private pay. If
Boy.
you don't need it for more than 60 days, new benefit period will kick in.
That's right.
And this leads to something you just said, Leslie. Do most practitioners accept Medicare, or is that not recognized by Medicare? You just answered that.
It's a church and state issue. So it is separate. They do not, the government does not pay for any part of our religious ministry. The time that Christian Science nurses read to patients, that is not billable time. We give that as a gift. So Only the care we give. That is what Medicare can reimburse for. And the
Perfect.
practitioner is separate.
Thank you.
Mhm.
When you say it's important to have an advanced healthcare directive or AHCD, does that mean you should always have it with you or just in a safe place like a wallet, like your pocket or wallet, or place at home or on your cell phone, or where should it be?
You can scan it and have it on your cell phone, but I think carrying in your wallet, if you just even had a contact information for your agent who you've designated as your emergency contact, and if they have a copy of it, that they can produce it, that is really helpful. Or if you did have it on your phone, if you can scan it and have it ready, but you may not be in a position to be the one that's responding. So have a contact person who can access it.
Great, exactly. You've got to be able to find it.
You know, at home, the place you want to have things like that, if you have a maybe elderly parent at home, put it on the refrigerator. If EMTs are called, that is where they look, on the refrigerator door. They'll look for these legal documents.
Perfect. Next up, Jim has said it was his opinion that the supplemental G plan was the best for Christian Scientists. I think I have an N plan. There we go again. But why is the G plan best for Christian Scientists?
A couple reasons. First off, there's different types of physicians that take Medicare or take assignment, right? And with Plan N, you have to worry about that. In other words, if a physician agrees who's working on you outside of a facility, they agree to assignment, they agree to pay whatever Medicare pays them as payment in full. If I'm a physician and I just take Medicare and I don't take assignment, I can charge more. I can balance bill. It's called a limiting fee. And normally it's about 15% more. With Plan N, you actually have to worry about that, right? Are you a Medicare provider or do you take assignment? You also have to pay that $203 deductible and you have co-pays. I just think, quite honestly, for the cost you're saving, normally it's about $20 a month is what I see. I just don't think it's worth it. With Plan G, you don't have to worry about just the doctor takes Medicare, you're good. Once you pay that Part B deductible, especially if you're in an ambulance and you're going to San Francisco General and you've got that monster bill, you're right now responsible for the first $203. After that, you're covered in full. You don't have to worry about co-pays or gee, did the doctor that treated me, do you take assignment or just Medicare? It just makes it easy, right? We've done this a long time and people want easy. You don't want to have to worry about what's going to be covered, how much am I going to pay, things like that. So I think Plan F I used to use all the time, but now, quite honestly, Plan F, there's enough of a spread with Plan G where you can pay a little lesser premium, right, in the savings and more than cover your Part B deductible. So I think Plan G makes sense for all those reasons. I really do.
And I was just thinking of our daughter. I remember a few years ago, you'd say something, she'd go, wait, what?
Yeah.
So those that we have people in our audience, or not in our audience maybe, but others that say, you know, we'll pay this out of pocket, you know, we'll self-fund. Right. And your kids are going, wait, what? It's just like, let's think this through, because eventually it could get to them, you know, in terms of how they're, anyway.
Right.
So,
why, John, why pay the hospital if they have that protection? They can not only help their children, but their favorite 501c3 charity too, right?
Yeah, there you go.
Right? I think that works well.
Right. Next up, I have Medicare Part A. If I get Medicare Part B, how do I calculate the penalty?
That still goes back to that for every 12 months that you didn't have it, it's a 10% penalty, but the overall entity that is going to be able to tell you what exactly that penalty is going to be Social Security. Right. We can give you what the calculation is, and that's what the calculation is, but they're the ultimate ones that are going to figure out and assess that penalty.
Great. How do I get, Leslie, this is for you. How do I get the Advanced Healthcare Directive document?
We have it available on our website. The one that we have has been vetted by Christian Science attorneys in California, but it should work in other states. What you might do is look at it. It's kind of a template. You can make adjustments. You can choose to use parts of it, sign part of it that you want to use. You can put a line through parts you don't. then have it reviewed by your attorney in your state to just be sure that everything is set for your state.
And thank you. And we're also part of AOCSN, which is all of the Christian Science nursing facilities throughout the world. But we have shared that document with all the facilities in the United States. And so some of them have that on their website, depending upon where an individual is. But you can always go to ardenwood.org and to look for the Advanced Healthcare Directive, or AHCD. Can't emphasize enough how important it is.
And just
Next up.
customize it to you. Make it work for you.
It's got to work for you. Exactly. Good question. I don't think we've heard this question. Does Plan G cover visiting nursing? Visiting Christian Science nursing?
I'm going to say probably no.
That's
Yeah.
where the fund
Medicare
for
does
Christian
not
Science.
cover home nursing for us either.
So
That's where the fund for
supplement
Christian
would
Science
cover
nursing would
whatever
help.
Medicare covers. So
Right.
for the supplement to cover it, Medicare would have to approve it.
Right.
Yeah.
They did a pilot program about close to 20 years ago and realized it wasn't going to work. So Christian Science has never been included in home nursing coverage, but the National Fund for Christian Science Nursing could. And typically a visiting Christian Science nurse visit is maybe an hour or two. So we're not talking a huge amount of money, easily fall under their limits. Yeah.
Yes, the National Fund is just wonderful in that regard. Next up, I'm 67. How do I reach United Healthcare AARP?
You call us. It's the
That
easiest-
was the next question. How do I reach Katie and Jim?
Yeah, our information's gonna be there somewhere on your website, but you can always just call us and we can help you, put you in contact or help you get a policy or whatever you want to do.
Yeah, and we'll also have all the contact information at the end of this of our program today.
And the nice thing by working with us, you can call us when you have an issue, a question.
Right.
I'm not expecting you to call the insurance company and try to explain
Right.
to them your
That's true.
situation or what's going on with you, because I find, especially with Christian Scientists, if you have to try to call the insurance company and explain to them that you're a Christian Scientist and everything like that, it becomes more of a hassle. Versus we're familiar with that, we can help you, and it's the same rate whether you go directly through the insurance company or whether we help you.
Right.
You just have someone on your side to try to help you
You know,
out.
that's a good point. We're compensated by the insurance company every year to help you. So it's not like, you take a policy out, and that's the problem. If you call an 800 number, right, you get an 800 number to help you. But we're compensated every year for as long as you have that particular policy. So we have an interest in helping you. We want to make sure you reach out to us first, or instead of letting an issue get so far along that it's become a major problem, call us and we get involved early on and we can assist.
Perfect. Got a few more questions, and if we'll be winding up soon. So if anyone has a question out there, please send it along, please. What is the time frame? This is another, we've touched on these things, but reading it. What is the time frame for signing up for Plan G?
So if you haven't signed up for that previously, we can sign you up. If you have A and B, we can sign you up now. That would be, call our office.
Right.
We walk through before we submit anything, walk through the questions that are going to be asked, so you know that ahead of time. And then if the answers are no, everything looks good, the rate sounds good, then we would work with you on submitting the application to get that started.
So there is no open enrollment for when it's not a guaranteed issue period. You can apply every month, quite honestly, with an insurance company. So it's the government side what we're talking about, the general enrollment period. So you can try every month, quite honestly.
I think it's important to note, I don't know that we've made it clear or mentioned it frequently, but with the Medicare supplement, they're not going to require an exam, a doctor to look you over, blood work, none of that.
Right.
It is simply that you're answering the health questions, and then they would issue the policy. There's not going to be any invasive things like that.
Yeah, no, thank you for bringing that up, because we do get asked that. That's correct. Yeah.
Next up, I am 68 with Medicare Part A in Washington State. A lot of activity going on in Washington State. We've got several questions from up there. I'm 68, Medicare Part A, Washington State. I'm grandfathered into the Serving Christian Scientists, or SCS insurance plan. I'm wondering which is better to stay as I am, or cancel the policy and add Medicare Part B with a 20 to 30% penalty and the supplemental G. What say you?
I'm going to jump in and then let Jim take it away, but look at your SCS policy. They are very good about paying, but they don't always pay a lot. So it is a daily reimbursement. It's not going to be as robust as a Medicare supplemental plan. So look at what it is and then call Jim and Katie and have them walk you through.
Right.
And
Go ahead.
I think especially in this case, because there's some other things working, behind the scenes and having that other policy, that would be a good conversation where we would have with you
Right.
specifically to talk about, what the penalty would be, and we can talk about what the cost would be for the supplement. And then it's up to you to decide what works best. And it may be that they both work and you have them both. And that's a conversation we can definitely have.
But definitely do not drop that
No,
policy.
no,
Do
no.
not do
Yeah.
that until you look at other options. I've gotten that question quite a few times from some Christian Scientists regarding their long-term care policies. When they found out they should have had a Christian Science writer on there, they were told that, and there isn't one. But I think the knee-jerk reaction is to say, well, I'm going to cancel it and I don't want anything to do with it. And we're like, don't do that, right? We have to look at everything. That's not a prudent decision to just say, I'm going to get back at them by dropping the policy, because that could really hurt you. So I'm like, Leslie, you want to look at the options, right? How much you're getting now, and is it worth doing the penalty and getting a supplement plan?
And there are patients that I've worked with over the years that have both. They have an SCS policy, which is have a supplemental. They actually can make money while they're here.
That's good. Okay.
I've actually seen that, because they're still getting the daily rate and they can get it while they're Medicare covered. So they may be getting $100 a day
Wow.
for the first 60 days.
Leslie's
they're
figured out how to work.
Yeah,
the
that's
system.
good.
I've seen it happen.
Right. Well, you know what, Leslie, you're paying for that service, right, through the insurance company. So you deserve the benefit too.
Mhm.
Yeah. It's not offset. In other words, it's not offset. If they have the supplement, they're still going to receive that benefit. Yeah, that's a good deal.
This is, we've gone through this, but maybe just touch on it briefly. Please explain what Part G is.
So Plan G is the supplement. They make it confusing, and I wish they didn't. So when you go with the supplement in most states, they have, A, B, they have them as an alphabet. So Plan G is the supplement, and that's merely the insurance from the insurance company that would supplement original Medicare, that Part A and B.
All the plans are standardized, right? All the letters A through whatever it is now. And G is just part of that. So like Katie said, in most states, like if Amy were on, she'd be able to tell you Massachusetts doesn't work like that. They're different. Yeah, they have their own rules in Massachusetts. But for most every other state, they're all uniform. The only difference is, premiums, quite honestly. But Plan G is Plan G pretty much everywhere, with the exception of a few states.
I'm going to jump to this one. What about Plan F? We've talked about that on Tuesday.
Right. Plan F used to be, that was kind of the Cadillac plan out there where everyone would buy Plan F, right? Because it's easy. You pay a premium to the insurance company, John, and it doesn't matter if it's under Part A or Part B or whatever Medicare approves, you're covered in full. You don't have to worry about a deductible or is this doctor Medicare or assignment or any of that stuff at all. It's the Cadillac plan. Well, a few years ago, they passed legislation that took away Plan F. Plan F is still available. So if you were 65 prior to January 1 of 2020, you can still purchase Plan F. I know everyone says you can't get it, but you still can. If you're born after that, if you turn 65 after January 1, basically out in 1955 or later, you can only get Plan G. Plan G is very close to Plan F, right? That exception, you pay that deductible. But again, if you can save enough money, if I can save $400 or $500 a year in premium off Plan F, John, and I have to pay $203 or next year $215, I'm money ahead. So a lot of times Plan G makes sense. But I have a lot of clients that have had major claims, not Christian Scientists, but a lot of non-scientists that have had some pretty heavy claims, and they tell me they will never, ever drop Plan F. I've had people in Stanford for 3 weeks, $1.5 million bill and it's paid in full, and they go, we're never going to change Plan F. So they have the right to keep it. The nice thing about supplemental plans, since I'm on this rant right here about talking about, they are guaranteed renewable, meaning that as long as you pay the premium, like that individual that had the $1.5 million claim at Stanford, as long as they pay that, they can't cancel your plan. They can't turn around next year and say, nah, gee, Katie, you're bad risk. I think we should get rid of you. They can't do that. So that's the plus about good supplemental company, guaranteed renewable. And that's how Plan F works, John.
Just a few more questions. We're just over the 5 o'clock here in California. I think there was a little confusion. How is Part G in Massachusetts different? And just somehow that, I think we were joking, but it just, yeah.
Okay.
And I'll go into this very briefly. So in Massachusetts, they don't have Plan G or Plan F. They only have 2 different plans now. They have the core and the 1A. If you're in Massachusetts, call, because that's just totally different.
And then we can bring Amy into the discussion too. So that'll help.
This is what happens when you joke.
No, but it is. It's I think there's 3 states, right, that have different rules, but the majority are Plan F and G, right?
Exactly.
And those are the most common.
Is there insurance coverage for residency for a relative with an impaired mental condition? Leslie?
I don't know.
And then I guess not at a Christian Science facility that I'm aware of.
Right. I mean, it might be a Medicaid type situation if there's a disability, if it's that type of thing. I am not aware of any Christian Science facilities that are participating in Medicaid program right now. I'm really not sure.
Jim or Katie, in terms of a medical?
Well, mental health is covered under Medicare, right? So it's just like if whatever Medicare approves on that, the policy would pay. There are limitations for inpatient services.
Normally that's covered if you need like inpatient care, or if you need like outpatient, if you're going to like therapy visits.
Right.
But as far as like an institutional stay, no, that wouldn't be covered.
The word that got me was residency. So
Right.
it's sounding like a long-term care. Medicare does not cover long-term care.
No.
Correct.
That's a whole nother insurance. So, yeah.
If not, this is the follow-on. If not, where is information about memory care help?
Well, you can go to the internet, right? There's a lot of facilities. We live in the Sacramento area. I know UC Davis has a great program. There's lots of facilities out there. You would just have to research that kind of on your own, quite honestly, I think.
As far as needing like memory care help,
Right.
that's where you would have to look into a facility and what they would provide. Unfortunately, at that point, a long-term care policy wouldn't be an option. Because you're already at the point where you're needing care. So the insurance company wouldn't cover you for that. But I know, and this may be getting a little off topic, that there are some places out there that will help you if you have a family member that needs care like that, where you can get in touch with them and they can tell you the facilities that are available and help you get into one and stuff like that.
Yeah.
Fantastic. 2 more. Does that NNSRS, I don't know what that is, NNSRS fund work if your financial condition is not needy? I wonder if they mean the National Fund for Christian Science Nursing.
Yeah. It is needs-based. They don't expect you to have sold your home. Obviously, if you're sitting on a very hefty bank account, you do have to disclose that information and you may not qualify. I would say the average person does qualify. So it just depends on how much you have, but that's something they can determine fairly quickly.
And there's an honor situation here. I mean, it's not designed for people that
don't need it.
That don't need it. It's designed to really support Christian Scientists who are seeking Christian Science care. That this helps them make that decision forward. Last question. I'm a bit confused about the dates involved. Open enrollment. Do I have to add Plan B during open enrollment or wait until January and contact the Social Security Administration and skip the open enrollment period?
Yes.
I think that's the short answer. So when you're dealing with Part A and Part B, that is through the government. So this open enrollment window doesn't apply for Part A and Part B. If you've had Part A and you haven't had Part B, and it's not that you're still on a group plan, you're retiring, then yes, you are subject to that general enrollment period. And they are correct. That starts January 1st and runs through March 31st.
I thought my answer yes was pretty good. No? Okay.
But it underscores, it's confusing. And so
It is
the dates
confusing,
here, and
John.
yeah.
That's
Parts and plans
Right.
and, oh man, yeah.
yeah. You know what that's called for us? That's called job security.
Job security.
No?
My golly, exactly. Well, that's all of our questions. Thank you, Jim, Katie, and Leslie, for guiding us through Medicare as it relates to Christian Scientists. Please,
Our
again,
pleasure. Yes, and thank you,
Please.
John and Leslie and Amy and everybody. It's always a
us.
pleasure dealing with you, and I really like this format too. I really enjoy talking with everybody.
indeed.
Teamwork.
So
Yeah.
Right.
please, everyone involved, please, whether you're watching this today or on recording, please don't hesitate to be in touch with either, Leslie, Katie, or Jim, or with the Christian Science Provider Network, with Medicare or insurance-related questions. Everyone's happy to help. Next Tuesday is the 5th webinar in our 6-part series on estate planning. The topic is charitable lead trusts. So please tune in next week. You can find it on our website. And please mark your calendars for our online-only Christmas celebration titled Sing for the King on Sunday, December 5th at 2 p.m. Pacific. You can register on our website. Please invite family and friends to register too. So thank you again for joining us today. Look forward to a happy holiday period coming up, and goodbye for now.
Thanks, everybody. Bye now.
Bye-bye.